7,000 years ago, a hole was cut into a human skull, and that person survived. This is called trepanation, the oldest known surgery in the world, and it still baffles scientists today. This wasn't an accident, it was a deliberate operation, with no anesthesia, no antibiotics, and no modern tools. Let's go back 7,000 years to a time when humans were just learning to survive with fire, stone, and forest. These people lived in the forest. They ate wild fruits and berries, slept in caves, and survived together as a community. But there was one thing that terrified them more than anything: sickness, injury, and pain with no cure. Sometimes someone had a severe headache, sometimes someone suffered from seizures, and sometimes someone was struck on the head in battle and fell unconscious. And ancient healers believed something strange, that evil spirits lived inside the head, causing all this pain. So they came up with a radical idea: cut a hole in the skull and let the spirit escape. It sounds impossible, but archaeologists have found real proof. Skulls from thousands of years ago with healed holes in them. Healed bone means one very important thing: the person didn't die on the table. They lived on for months, even years. This has been discovered on every continent, from France to Peru to China. Ancient humans everywhere were doing this. In Peru alone, over 800 trepanned skulls have been found, some with survival rates higher than battlefield surgeries from the 1800s. So how exactly did they perform this surgery without modern medicine? Let's break it down step by step. Step 1, the patient was made to sit or lie very still, sometimes held down by 2 or more people. Step 2, the healer used a sharp stone, usually flint or obsidian, to slowly scrape or cut into the skull. This process could take hours, done slowly and carefully, to avoid damaging the brain underneath. Some healers used a drilling and scraping method. Others cut a square shape and lifted the bone piece out completely. And somehow, against all odds, many of these patients survived the procedure. But how do we know they survived and weren't just operated on after death? The answer lies in the bone itself. When bone is cut while a person is alive, the body begins healing immediately, smoothing and rounding the sharp edges over time. If the person had died during or right after the surgery, the bone edges would stay sharp and rough forever. This is called bone remodeling, and it's the scientific proof that these ancient patients lived on after surgery. Some skulls even show multiple healed holes, meaning the same person survived trepanation more than once in their life. So the next big question is, why would ancient people risk something this dangerous again and again? One theory says it was medical, used to treat head injuries, skull fractures, and swelling from trauma. Releasing pressure from a swollen or injured brain could genuinely save a life, even by today's medical standards. Another theory is spiritual. Many ancient cultures believed the head was the doorway between the body and the spirit world. For seizures, madness, or severe headaches, healers believed trapped spirits or pressure needed a physical way out. And in some warrior cultures, it may have even been a badge of honor, proof that you survived a brutal battle wound. Now let's meet one of the most famous trepanation discoveries. A skull found in France over 100 years ago. This skull, dated to around 6,500 BC, had a hole that had completely healed, with smooth, rounded bone all around it. This discovery changed everything scientists believed about ancient medicine and proved that prehistoric surgery was real. Before this, historians assumed ancient humans had no real understanding of the body and no real medical practices at all. But trepanation proved these people understood anatomy, risk, recovery, and even basic surgical hygiene. Some skulls even show signs that wounds were cleaned, and that healers understood infection was dangerous. Researchers believe some cultures used natural antiseptics, like herbs, ash, or tree resin, to help prevent infection. This means ancient humans weren't just surviving. They were actively problem-solving, testing, and improving their methods. Over generations, this knowledge was passed down, refined, and shared between tribes and communities. Let's now look at what tools they actually used to perform this incredibly precise surgery. The most common tool was sharpened flint or obsidian, natural volcanic glass that could hold an incredibly sharp edge. Some cultures also used shark's teeth, shells, or even bone fragments shaped into fine cutting tools. These tools were carefully shaped by hand, often taking hours of patient work before they were even sharp enough to use. Now, let's talk about something remarkable: evidence that ancient surgeons may have used natural pain relief too. Some researchers believe plants like willow bark, poppy, or coca leaves may have been chewed or applied before surgery. These plants contain natural compounds that can reduce pain and swelling, something ancient healers may have discovered through trial and error. While we can't confirm true anesthesia existed, this shows a level of medical thinking far beyond what we once believed. Let's talk numbers. How many people actually survived this incredibly risky procedure? Studies on ancient Peruvian skulls show survival rates between 70 and 90%, astonishingly high for such a primitive procedure. Compare that to battlefield surgeries from the American Civil War, where survival rates were often below 50%. This means ancient Stone Age healers were, in some ways, more successful than surgeons thousands of years later. So why were ancient survival rates so high? Scientists believe it comes down to careful, patient technique. Unlike rushed battlefield surgeries, these procedures were done slowly, over hours, minimizing blood loss and trauma. They also avoided cutting too deep. Most trepanations only removed the outer skull layer, protecting the brain underneath. This level of precision suggests these healers were highly experienced, likely specialists within their communities. In fact, evidence suggests trepanation wasn't performed randomly. It required training, passed down from healer to apprentice. This means trepanation may have been one of humanity's very first specialized medical professions. Now let's address the big question. Did trepanation actually work as intended, medically speaking? For head trauma and skull fractures, modern doctors agree, releasing pressure from brain swelling absolutely can save lives. In fact, modern neurosurgery still uses a very similar technique today. It's called a craniotomy. The core idea, cutting into the skull to relieve pressure or remove damage, hasn't actually changed in 7,000 years. For conditions like seizures or mental illness, however, the results were likely far less effective, medically speaking. But even then, the ritual and belief behind the surgery may have provided real comfort and psychological relief. This blend of real medicine and spiritual belief is something we still see in healing traditions around the world today. Now let's look at something even more incredible. Evidence of veterinary trepanation, performed on animals too. Archaeologists in France found a cow skull dating back thousands of years with a healed trepanation hole. This suggests ancient humans may have practiced and refined this surgery on animals before performing it on people. It shows a level of scientific testing and experimentation that we rarely credit to prehistoric humans. Let's now travel to one of the most fascinating trepanation sites ever discovered, in ancient Peru. The Inca and pre-Inca cultures performed trepanation more frequently than almost anywhere else in the ancient world. Some sites show evidence of hundreds of successful surgeries, performed across many generations of skilled healers. Researchers believe this region may have developed the most advanced trepanation techniques in the entire ancient world. Let's take a moment to actually walk through this ancient operation from beginning to end, step by step. First, the patient is brought to the healer, often after days of pain, injury, or illness that hasn't improved. The healer carefully examines the head, feeling for swelling, injury, or any visible signs of trauma. Once the exact spot is identified, it's carefully marked, often with a scratch, ash, or natural dye. The patient is then positioned carefully, often held steady by assistants to prevent sudden movement. The healer begins the cut, slowly and precisely, checking constantly to avoid going too deep. Throughout the process, the patient is closely monitored, watched for breathing, color, and consciousness. Once the hole is complete, the area is cleaned, and sometimes covered with a piece of shell, gourd, or bone. This artificial covering may have helped protect the brain while the bone slowly healed over time. Finally, the wound is wrapped, and the patient is left to rest and recover, often for many weeks. And if all went well, weeks or months later, that hole would begin to heal, just like any other bone injury. It's genuinely remarkable, a full surgical process, thousands of years before modern medicine even existed. Now, let's address something important. Not everyone survived this procedure. Many attempts, sadly, did fail. Infection, blood loss, and brain damage were very real risks. This was an incredibly dangerous procedure by any standard. Despite the risks, ancient people continued performing the surgery for thousands of years across dozens of different cultures. This tells us something powerful. Humans have always been willing to take great risks in the pursuit of healing. Let's now shift to something surprising. Trepanation wasn't limited to ancient times. It continued far longer than you'd expect. Evidence shows trepanation was practiced well into the medieval period, and in some remote regions, even into the 20th century. In parts of East Africa, this practice was documented by explorers and doctors as recently as the 1800s and 1900s. This shows just how effective and trusted this ancient technique remained, passed down for thousands of years. So what does all of this really tell us about our ancient ancestors and how we view early human intelligence? It tells us that ancient humans were not primitive, simple-minded people. They were problem solvers, innovators, and healers. They observed the world carefully, tested their ideas, and passed down knowledge that helped their communities survive. In many ways, the roots of modern medicine can be traced directly back to moments just like this one. Every surgery performed today, in every hospital around the world, has a distant echo in what ancient healers first discovered. So the next time you think of ancient humans as simple cave dwellers, remember, they were also our first surgeons. And that skull, with its healed hole, found thousands of years later, is living proof of that incredible story. If you found this story as fascinating as we did, make sure to subscribe for more incredible pieces of forgotten history.